So you're all familiar with her, and she's spoken to us before. I consider her a longtime friend and colleague, and she's been at McCullough-Hyde for many years. She's worked on both the clinical side and the administrative side. She's gone through multiple changes, including huge clinical changes, technology changes. She's helped get McCullough-Hyde through a failed merger and a merger. She's worked through a number of hospital administrators, and throughout all of this, she's been a stabilizing factor. Now she is saddled with COVID. She is about to retire at the end of the year after long distinguished service. And with her retirement, McCullough-Hyde will lose its main stabilizing influence, the historian of its in-house history and culture, and she will be sorely missed. Pam, welcome.
Thank you so much. Am I supposed to move now to share this? No.
Yeah, you can do that on your own.
Okay. I'm going to pull up the presentation that I'm going to give. I just want to thank Terry. That was a great introduction, and I'm glad you didn't add up all the years because I would have felt really, really old. One thing, Susie started off by asking about my cap, and I have to let you all in on the story that when I first started attending board of director meetings many, many years ago, her father was the chairman of the board, and her dad has always believed wholeheartedly that the only way you can identify a nurse is by the fact that she has a cap on her head. And so he was quite perplexed when I didn't come with my cap. And so since 1989, we've had an ongoing question and answer about where my cap is. And so when he asked me where my cap was, I told him that it was more important what was in my head as a nurse than what was on top of my head. So, but I still have that cap somewhere, and I have promised that I will resurrect it. And I have to make good on that promise. So I want to thank you all for the support that you continue to give to McCullough-Hyde. I will tell you that the flag project is one that the hospital just really stands out when we have our flags on display. And I have heard so many people make comments about how much they enjoy the flags and when they're up. So I just want to thank you for the project, and am proud that the hospital is a part of it in the community. And before I launch into, I'm going to make a few comments about COVID because it is the world that we're in right now. I want to bring you a short story. I just got this letter about a week ago. So if at the end of this conversation, any of you are wondering about how we're doing and the kind of care that we're giving at McCullough-Hyde, I can reassure you that this story tells all. So it goes like this. On Christmas morning last year, my son suffered cardiac arrest and was resuscitated by paramedics and taken to McCullough-Hyde. They air cared him to Bethesda North, where he went into cardiac arrest 2 more times. Through the efforts of Oxford EMT, McCullough-Hyde, the air care team, and Bethesda North, he is alive and doing well. I was cleaning out a drawer and found Megan and Will's thank you note that was somehow missed when Megan mailed out thank you notes. McCullough-Hyde has been with us through Will's birth, sports injuries, and this catastrophic event, and has been wonderful. Thank you so much for your service. Please give Megan's card to the emergency room. And the emergency room card says, thank you for helping save the life of our son, brother, fiance on Christmas Day. We are so grateful for your sensitivity and expert care. Everyone was so kind during a scary time for us. Thank you. So that's a current story, but that's a story that has resonated through the years of history of McCullough-Hyde. So in spite of the pandemic and in spite of everything that we're facing, I want to let you all know that we've got a lot of good things going on. Just a quick couple of things about COVID, though. Pretty much our lives here have been all about COVID since March. We thought things had kind of calmed down, and we kept hearing about this third wave. And then in October, it really began surfacing. And I think for me, it started when I was observing when I was out and about that no one seemed to be wearing masks. I was like, what's up with this? We're not doing the right things. And then we had Halloween, and now we've had Thanksgiving, and we've been watching the numbers go up. As of yesterday, in our region in Greater Cincinnati, so this would be the major health systems in Cincinnati, there were 753 the hospitalized patients. The model projected by the University of Cincinnati was projecting that we would be at 819. So the model that's being used to project where this is going is tracking fairly closely. So now remember that number, 753 yesterday in hospitals in Greater Cincinnati. 1 month, January 1st, in 1 month, it is projected that we will go up to 1,500 patients in hospital beds in the next 30 days. And so when you hear on the news about hospitals being taxed, running out of beds, running out of staff, you can be assured that this is very real, and this is where we are experiencing what we're calling now a move from phase 2 of this surge to phase 3 of this surge. Now, here at McCullough-Hyde, what are we doing? We have 32 beds. We've identified 4 obstetric beds. So our surge is taking us up to 100% capacity. And then we will be adding beds, and we will be converting single patient rooms to double patient rooms. So we will be expanding our capacity here at McCullough-Hyde, and we will also be expanding our capacity within Tri-Health. We will be adding, currently we have 700 beds, 699 is the exact number, but we will be expanding over the next 4 weeks to add an additional 327 beds. That's almost like standing up a whole new hospital in order to be able to have a plan in place to take care of people who may be coming our way. So that's kind of eye-opening. When I heard those projections and those numbers and the fact that we're going to double in the next 30 days, my attention, I was all in on terms of what we need to be doing and how we need to be planning. Now, I can tell you that finding beds and designing and redesigning spaces to come up with where you put beds is very, very easy. What is much more difficult is to find the nurses with or without caps, and the patient care assistants and the respiratory therapists and the lab phlebotomists and the technicians and the physicians that will take care of these patients. So what we have been doing is we are recruiting anyone who wants to help. We are identifying anyone in retirement who wants to come back and dump in and help us through the surge. We are calling upon nursing students, and we are taking nurses who no longer have roles at the bedside and inviting them back to the bedside to work with expert nurses, and they will be paired with expert nurses at the bedside. We are doing all types of things to recognize and reward folks who are literally coming to us saying, I'm willing to help out. And we've had lots of people who have said, yes, I'm here to do extra so we can get through this together. One bit of news that I found encouraging locally is when I looked at the data that came out of the health department yesterday from Jenny Baylor in the 45056 zip code. If you take out Miami students, so the bulk of our numbers have really been driven here locally by what happened at the university. And the university did do an excellent job of getting a hold of the outburst of the pandemic, the surge at Miami. And really by the end of the semester, the numbers were significantly lower and it was very well managed. But if you take out the students, the number that I saw yesterday was 321 positive cases in 45056. And the positivity rate for that was 2.3%. So what that tells me is that locally in the 45056 zip code, we do have folks who are respecting science and who are following what we know to be 3 key practices: wearing masks, keeping a minimum of 6 feet of distance, staying within your own cohorts, and only going out for essential runs and using delivery services whenever possible. It really is making a difference here. And if anything, here locally will help us. What I think is our wild card as I look at what's going to happen at McCullough-Hyde over the next 6 to 12 weeks is, we may be getting patients from other hospitals that are transferring to us because we have capacity. So it's like a puzzle, and the pieces change every day. And actually, it's almost like a kaleidoscope where you shake it up, and the picture yesterday and the picture today, they're different images that you're looking at. So constantly doing work. I want to thank specifically Ralph and Marie Gutowski for coming to our facility 2.5 weeks ago and really observing that we had some unsafe practices in our lobby because we had too many people, and we had people that were coming for different reasons. And some of the people that were coming to get tested for COVID. And I want to thank you for bringing that to my concern, because we jumped right on that. And within a week, we were able to set up a drive-by testing service. So now anyone who's coming to us for COVID testing Monday through Friday, if someone is not super sick, so we have our priority care, our urgent care, and we have our emergency department for folks who are sick and symptomatic and need to be evaluated. But for people who are being screened or who have mild symptoms, we do now have a drive-by testing Monday through Friday, 8:30 to 5. And what that has done is it has alleviated the congestion in our lobby, and it has resolved that issue. So with observations of everyone, it really has helped us do the right things to keep everyone safe. And interestingly enough, just prior to this meeting, I got off a system call, and the very same conversation I heard about Mark Clement had received a complaint from one of the Board of Commissioners in the city of Cincinnati about being a client and observing a lobby that was too crowded. So I thought to myself, we're not alone in experiencing these types of issues, but I'm so glad that we were able to get on top of it and now have this other alternative that is much safer in place. So thank you, Ralph, and thank you, Rosemarie. A couple of good news things in regards to the pandemic that I think is important for everyone to know. We have the freezers. We got our own freezer on Monday. So yes, we do have the freezer that goes down to minus 80 degrees Celsius, and it will be housing vaccine that we are expecting to be receiving within the next 2 weeks. So we will begin distributing vaccines, we hope around the 15th of December. And our groups that we're starting with are folks who are working on the very front line. So our nurses, our physicians who are in daily contact with folks who are very ill, folks who have COVID. So that is very promising. The vaccination program is just going to continue to expand, which means that hopefully all of us will get vaccinated and we will be able to feel safer in getting out of the bubbles that we've created for our own safety. And the other positive news is a week ago Monday, we started administering at TriHealth the monoclonal antibodies to folks who have symptoms early on. They can receive this infusion, and if they are high risk and they receive the infusion as an ambulatory outpatient early on, then hopefully it will avoid a hospitalization and a much more serious illness. And that is a whole nother strategy that we did not have in March that we have now that we believe will really help us kind of bring this pandemic back under control as quickly as possible. We also have remdesivir, which we are administering here at the hospital. And the tried and true drug that goes back through time that has really made the difference is Decadron. That was discovered to really be highly effective and has been one of the reasons why, while we are seeing increased hospitalizations at this point in time, the rate of ICU admissions compared to what we were seeing early on in the March-April time period has significantly subsided. So yes, we have sick people in hospitals, but they're not all vying for intensive care unit beds. They're not all being ventilated, and we're having sicker people, but not the sickest of the sick like we saw early in March and April. We are using the non-invasive ventilators and high flow oxygen therapies instead of putting people automatically on ventilators. So there are some very, very positive things that are going on right now to help us get through this pandemic. So before I move on to just a couple of quick updates about the hospital, does anybody have any questions?
Pam, real quick. So we hear about all these different vaccines that are available. Of course, the one that needs the deep freeze that you mentioned, and then the Moderna one that doesn't require such. Can you talk a little bit about the different vaccines? Is there one that's better? Is there one that has more side effects? Any comments on that?
Well, I don't really consider myself to be an expert. So my comments would be that if the FDA is approving them, they have to have a certain level of safety. The efficacy that I've read for the ones that are about to be released or that have been released, they look very high and promising. And, my personal opinion, not speaking for TriHealth or anyone else, is if I have the opportunity to get a vaccine, if Anthony Fauci is going to get it, I'm going to get it. So other people are a little more apprehensive and they have concerns and they want to see what happens as more trials are conducted and as people are followed over time. And I understand that, but I'm kind of tired of being in a bubble. And so I feel comfortable enough to take the risk to get the immunization, when it's available to me. But they're all interesting. The next, I think it's the Moderna. They require a different freezer system and a different. They're minus 20 degrees Celsius. The one that we have is minus 80, and then there's another one that doesn't require refrigeration. So they're all going to be different, interesting to follow. But I feel pretty comfortable. Terry, what would you say? You're on mute. Still on mute. You're still on mute.
Am I still now?
Nope, you're good.
I think the Moderna and the Pfizer are about 95% effective. The Pfizer was approved in Great Britain today, so I agree. If Fauci says get it, get it.
Pam, I have one question. The Pfizer takes 2 doses, right? You have to have after 28 days you get your second inoculation. Is that right?
The two that I'm aware of that have been approved and are going to be used both require 2 doses. Yeah.
Oh, okay. And when you get the first dose, that does give you some protection, doesn't it?
It's going to give you some, but I don't know. I don't know if anybody knows how much. Terry, have you read anything on that?
I think the data says that you really get good protection about 7 days after the second dose.
Oh, okay. All right. Thank you.
All right. Any other questions? Otherwise, I'm going to try to get to my little presentation that I had. Here we go. Can you see? Is it up?
Yes.
All right. So here's my quick update. And I know I've taken a lot of time, so I'll try to just breeze through these quickly. We already talked about COVID, and I hope you can see there are smiling faces there. COVID fatigue is very real, and there are many of us that are starting to wear out, but I want to assure you that here at McCullough-Hyde, our morale is good, and we get through things by sticking together, and that's how we're going to get through this. A couple things, you've probably heard this before. We still have the same goals. We want this to be a place where people want to work, where physicians want to practice, and where the community wants to come for its health care. So nothing different in regards to vision. We are continuing to work on physician growth. It's been an interesting process because I feel like it's been 2 steps forward and 1 step back. But we are currently this month, on November 30th, have started with regular pulmonary coverage. That's been an area that has been a gap. We have an excellent nurse practitioner, Dorianne Whitaker, who is here on a regular basis, and she's been with us for 3 years. But now we do have a pulmonologist, and Dr. Craig Eisentraut, who is excellent, is leading off this week with coverage. We are going to be adding neurology coverage via telemedicine. We have added psychiatry coverage in our emergency department via telemedicine. The psychiatrist at Good Samaritan and that whole team is available to our emergency department physicians. So those are some enhancements. We are recruiting actively for primary care because we know that Oxford Internal Medicine is very, very full right now with Dr. Perry Funk, who left us in February. Those physicians had to absorb his patient panel, and so we've not had the capacity to add patients. But Mike Everett, our president, told us yesterday that he is actively recruiting 2 practitioners, and so he is really trying to step up the recruiting game for primary care because we know that that's a real need in our community. As far as tier 1 status and contracts, I did check on that, and currently we are an Anthem preferred provider, which is very, very good, and we have tier 1 status with UHC. So we continue to look at our contracts, and our finance people are making sure that we are in the best tier from a patient selection perspective. And when you're tier 1, that means 2 things. It means that you offer good value, that your pricing is good, but it also means that you're offering great quality. So quality and cost are the 2 elements, that we continue to work on year in and year out. Engagement of our teams, we continue to work on team member engagement with our community. It's an ongoing process, and we do it the Tri-Health way, and things are going really well. In our most recent survey that we did of our team members, our score on a scale of 1 to 5 was 4.22. And considering that it's been a pandemic and a heck of a year, we were very, very pleased with that. Effective marketing and communication, I neglected to mention that we also added a new obstetrician and gynecologist, Dr. Sanaka. She joined the practice in April for Oxford, the OBGYN practice here in town. And so yesterday, we're getting ready to remodel our OB unit. We were talking about how we can profile and introduce Dr. Sanaka to our community. So we're going to be doing some more plans to really communicate what we're doing so that our community knows who we are and who we have to offer. So the Tri-Health Way, I just mentioned that we're in almost 6 years of work on the Tri-Health Way of leading, the Tri-Health Way of serving, and the Tri-Health Way of delivering care. And really, it's all about excellence. It's all about having the best patient experience. And it's about measuring what we do and identifying what we're doing well by our metrics and identifying the opportunities that we have. And it's an ongoing process, and we've been getting better and better. We get better in certain things and we get to the top, and then we work on other things where we still have opportunities. Effective big change that happened, and Richard and several of you, Ralph, were very instrumental in the whole affiliation process. We were in it together. It was a great experience. I can say I'm not sure I would want to do it again, but it was a great life experience, very positive, learned a lot. And as of July 1 last year, in a successful negotiation, Tri-Health is now a 100% owner operator, and our foundation, McCullough-Hyde Foundation, is really taking off. So proud to see what the foundation is doing, and I really feel that the foundation has its own legs, it has its own identity, it has its mission, and it is really, really on its way. And I love the vision, and it's something that we had to work our way through, and these things take time. So I'm glad to see both of us are thriving. Quality, performance, and improvement. The next slide that you're going to see is not anything for you to interpret, but I want you to look at the colors. Oh, I need to mention our leapfrog grade. We were all straight A's. This is the first B that we've had. We had 6 A's. We're rated twice a year. Leapfrog is an independent entity that rates quality and safety in hospitals. And we unfortunately did get a B this spring, and we're not happy with that. And we're working back to get our A, because, you know, A level is where we want to be for our community. This is the slide that I referred to. This is just one small example of the types of quality metrics that we look at. We have a quality council. Many of you that are in the meeting today have sat on that council, and you have received these reports. And green means that we're doing well and we're achieving the targets or exceeding them. Yellow means we need to focus, and red means we need to do some work on this. So there is one red on this slide that I'm showing you, and it's about outpatient heart attack times, acute myocardial infarction, AMI, and it's about transfer times. And I will tell you that getting people out of McCullough-Hyde has been a problem for many, many, many years when we have an emergency situation. I am very happy to report today that we just this past month successfully negotiated a contract with a company by the name of MedFlight. They are stationed in Eaton, Ohio. They are 12 minutes away by helicopter. That's a really good thing. But I know Terry's already thinking, but helicopters don't fly all the time, and then what are you going to do? And the beautiful thing about this contract is not only do we have access to the helicopter, but they also have subcontracted, and we have 2 land arrangement transport. One is between Oxford EMS and MedFlight to form a critical care transfer, and the other is with a company by the name of MedPro, which means that when we have a heart attack or we have a stroke or we have some life-threatening situation, you know, that we have to get out in minutes, then this contract that we have in place now, we call them and they make all the arrangements and they get here. So I will give you an example. We had a business meeting with them in the end of October, the 29th of October, and all the key players were at the table. We were in the conference room right outside of the emergency department, and Dr. Chris Zammit is the head of the stroke program at TriHealth, and he was out presenting to our emergency department and our team here. And we also had the MedFlight people at the same table, and all of a sudden, we got notified that there were 2 strokes coming in to the emergency department at the same time. Dr. Zammit jumped up with joy, glad to get out of the meeting, went downstairs, worked with our ED doc, took a look at the situation. But what also happened is, without an agreement, our MedFlight partners or prospective partners at that time said, hey, we'll bring our unit and we'll get somebody here. And within 34 minutes, they had a unit here and that patient was out the door. So it really is very, very encouraging to have this contract in place. And I have confidence now that that red is going to turn a different color. It's going to turn to green because it's going to help us get our patients out so they can get the care that they need in the timeframes that we need to hit. So big win for us. Some other recent wins you see up here, I already talked about several of them. We are also working on telemedicine coverage for our intensivists to help in our intensive care unit. And we've added another neonatal nurse practitioner to our pediatric team to help on our OB unit when we have infant resuscitation. And then at the very bottom, I'm very proud to display that Anthem has awarded us Blue Distinction for our total joint replacement program, which means, again, we offer quality and value. And we just got notified within the last month that we received the same designation, but it's Blue Distinction Plus for our maternity care. So I'm very pleased to be able to offer that to our community. Some upcoming projects. We did finish the outpatient lab draw station. If you've been in our lobby, it's just right next to the restrooms. It's very convenient for people, easy in, easy out. And another project that was not necessarily glamorous, but it was necessary, was to remodel our central sterile supply. And that got done this summer. And the one that you see at the bottom of the list is now at the top of the list. And my next task is to get that capital project in. It has been approved and we will get started on that. It is a 6-month project because it will be done in phases, but we hope to get this accomplished by mid-2021. So very, very proud to be able to move on to renovating our OB unit. And then last, Without our community and our partnerships, we cannot serve the way we want to. And here pictured, you see Dr. Faisal Adami and Dr. Shirin Shatavi, two of our oncologists in our oncology program. In terms of growth, we've gone from 2 days a week oncology coverage to 5 days a week and 3 oncologists, and we've done that within 5 years. And that has been an area where I really feel like we're serving our community so well. But you can see here, we have at the top of the list the internship program that we're working with you all on now. So thank you for working with us. We look forward to getting that launched next summer. Our park and playground projects, with our affiliation dollars, we've been able to place playgrounds in every single one of our surrounding communities and Oxford. It's playground equipment that allows children with disabilities and adults to play on. So we're very happy that we've done that. Mental health first aid, we have trained over 750 people in our program. It's a nationally recognized program to help lay people recognize folks that are in stress and distress who might need help. All of our police officers have completed this program, and they've said it has helped them greatly. Yoga in the park, hopefully we did it this summer on a limited basis. Next summer, I hope we're back full-fledged. Our school-linked healthcare program continues, even though school's been a little different this year. Drug take-back days, you see all the things there. We want to continue to be an integral part of our community. The last one that the next to last one I want to comment on, though, is the shuttle service. You may recall that early on, after affiliation, we had to shut down the shuttle service that we have. I'm happy to let you know that we are able to bring that back. We have reconfigured it, and beginning at the end of January, or beginning sometime in January, we will be offering a shuttle service to help people get to medical appointments. And we will also be helping at the university with getting students transported to and from the health center. So more to follow on that, but we're very, very excited to be able to bring that service back. And just want to say thank you to you. You provided us with lunches. We have had so much support through the COVID, and we just appreciate everything that you've all done. We cannot say thank you enough. So thank you for this opportunity. Any questions?
Pam, thank you so much. I'm sure we've got a question or two. All the information that you gave about COVID was so timely, and we talk about it a bit every week, and appreciate the update.
You're welcome.
I'd like to ask Pam, have you encountered much resistance to the idea of vaccinations in general in this area? And have you encountered very many people who still don't take COVID seriously?
On a weekly basis, yes. Yes, unfortunately, yes. There's a significant number of folks that really do not believe that it is much of anything. And there are a significant number of folks who are not comfortable with the vaccine at this point. So that's partly why probably the pandemic will be with us longer than it could be, simply because we have folks that have different beliefs.
Thanks.
Pam, not a question, but I do want to make a comment and an observation. It's been my privilege to work alongside of you, so to speak, as a member of the board for 10 years. And I am sorry to see you retire, but it's well-deserved. And a lot of the credit that we saw in your presentation goes to the fact that it's you who were there leading the team and doing it in a great way. Before it was the Tri-Health way, it was Pam's way, and it worked very well. And we are so grateful for everything that you've contributed to the community through your selfless service and your great leadership potential. And we will miss you very much in that role. Tri-Health will have to hire 2 or 3 people to replace you. And that will take them 5 years to get to the level, at least, where you are. So thank you so much. Wishing you the very, very best in retirement. and that you get to accomplish all the things that you postponed for many years of long days and evenings serving us in the community through healthcare. Thank you.
Thank you. Well, I'll always remember those car rides. So we got to know each other really well on all those car rides. So karaoke, you know, we didn't do that. We didn't do car karaoke, but we did get to know each other. And one little thing, because we've all been in bubbles, since the COVID started, I have delayed my retirement. So I will be around just a little bit longer until we get to the other side. So, but I thank you for your kind words and thank you for your attention. And quite frankly, what's always kept me here are the people, the best people choose to work at McCullough-Hyde, from physicians, you name the role. It's what's kept me here. It's the people, the great people that are here that really do the work. And it's just been a privilege to be a part of it. So thank you.
Well said, Ralph. And I'll just add one thing, Pam, I'm so pleased to see the OB renovation on the list now. And as you know, that was one of my big concerns. And so
Yep.
That's just wonderful.
It's at
Just
the top.
wonderful. And I want to add my thanks for all your work that you've done there. It's been wonderful.
Thank you.
Thank you.
Richard, your glee at seeing OB addressed, there isn't another announcement or anything in the future here, is there?
No, I just knew that we needed that so badly at the hospital to kind of round out the picture, if you will. With
I know, I
tryout.
was just needling you.
I know.
Are
Well,
there
thank
any
you,
other
everybody.
questions?
Thanks, Pam.
Thanks, Pam.
Pam, thank you so much. Everybody, let's give Pam a hand.
Hi, Penny.
Pam,
All right, I'm going to sign off. Thank you.
thank you so much. Wow, Terry, thank you. That